Great. And then a few other Zoom logistics. We will be having a discussion-based webinar today. So we're really looking forward to hearing questions from the audience. We'll start off with some guiding questions, but would love to hear about what you're thinking about as you listen to our speakers today. So please enter questions in the chat box by using the chat icon at the bottom of your screen and hitting enter. We'd appreciate you remaining on mute. If there is a disruption today, we have the opportunity to end the session, and we'll follow up with participants afterwards. Great. So welcome to the 5th installment this year of the Accelerating Climate Resilience Speaker Series. We're thrilled to have you here today. Thanks again for joining us for this discussion. We'd like to share a little bit about the Accelerating Climate Resilience Series, which is now bringing global speakers. We have a global presence today with a speaker joining us from a neighboring country, Canada. These events are open to the public and are here to bring new ideas to you on what resilience means in your community and what climate resilience means. It's an opportunity to have conversations about climate solutions and opportunities, whether that be through zoning, equity, the arts, youth movements, etc. And we know climate touches on all parts of our lives. And so today we'll be highlighting the relationship between climate and public health. With that, I'd first like to turn the mic over to Sharon Ron, who is our Assistant Director of Public Health here at MAPC. Sharon and her team do amazing work with MAPC communities, finding solutions and building relationships with community members related to health, climate, equity, and more. So Sharon, I will turn it over to you for a few introductory words.
Thanks, Pat, and just echoing the welcome to the speaker series. Thank you for making time in what I know is a busy time of year before we all disappear for a week and then a month. So as our panels today will speak to, public health and mental well-being are inexorably connected to the health of our planet and to climate resilience. From how prepared our climates are to direct impacts like air pollution-induced asthma, to indirect impacts like the financial and mental stress of recovering from natural disasters, the implications are significant. And therefore, the inclusion of folks who are working in public health and mental health into conversations about climate resilience is essential. When we talk about climate resilience, our focus is usually on infrastructure, things like streets, grids, buildings. We ask questions like, can we build streets and grids that withstand extreme weather events that are only getting more extreme? Can our buildings be designed to produce less carbon and adapt to a warming world? Very important questions for sure, but as our speakers today will show, we also need to be asking climate resilience questions that focus on people, communities, individuals. To illustrate, I often think about the changes that we've seen in the transportation planning world, which might be familiar to the urban planners who have joined today's call. Traditionally, the focus has been on optimizing traffic flow, making things as efficient as they possibly can for motor vehicles. That's how we measured success in transportation planning. In the last decade or so, there's been a shift. We now emphasize pedestrian safety, accessibility, walkability, all these important things, and we call them complete streets. This new perspective calls for designs and policies that prioritize people, and we measure success through how safe those people are in using our streets and how accessible essential amenities are to them. This shift to focus on people calls for solutions that prioritize the voices of folks who have been traditionally left behind by planning efforts. It centralizes their perspectives and their preferences in finding solutions. And I believe it also leads to better solutions. Public health prioritizes people. It prioritizes social connections and keeping communities safe. And it has a lot of experience, unfortunately, during the last 3 years in figuring out how to communicate effectively and combat misinformation, all essential skills for climate resilience. Our speakers today are leading the equivalent of complete streets initiatives within climate resilience work. While replicating their exact programs may not always be feasible, I believe that there's value in learning from their approaches. So we invite you today to explore how their experiences can be applied to your upcoming climate resilience work within your communities. And in a shameless plug, for those who are interested in the work that is showcased today, please do not hesitate to reach out to the MAPC Public Health team. We would love to collaborate with you in building communities that are safe, healthy, equitable, and resilient in the face of climate change. And with that, I will not hold us back from getting to the meat and potatoes of today. Handing it back to you, Kat and Elise, to introduce our wonderful speakers.
Great, thanks, Sharon. As Sharon previewed, we have three amazing speakers, panelists here that we're so excited to learn from and hear from today. Our first speaker is Dr. Shalini Shah. Shalini Shah is a practicing board-certified pediatrician, environmental medicine physician, and assistant director for the Boston Children's Pediatric Environmental Health Center and Region 1 Pediatric Environmental Health Specialty Unit. She has additional roles as co-director for the Environmental Justice and Climate Change Scholars Program hosted by the Region 1 PEHSU, National Climate Advocate for the Massachusetts chapter of the American Academy of Pediatrics, and serves as the co-chair for the Academic Pediatrics Association Special Interest Group on Environmental Health, Climate Change, and Sustainability. She provides clinical care in both primary care pediatrics and the environmental health clinic for patients with environmental exposures. She's passionate about the intersection of the climate crisis, environmental justice, and children's health. Her research and academic efforts are aimed at integrating environmental health into clinical practice with the development of an environmental health screening program and educational materials for patients and providers that highlight climate-related health risks and actionable interventions. Welcome, Dr. Shah. Our next speaker is Meghan Wise. Meghan is a settler descendant of Danish and Ukrainian farmers who grew up in the unceded territory of the Syilx people of the Okanagan Nation and currently resides on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh in Vancouver, British Columbia, Canada. Meghan is the coordinator at the Climate Hub at University of British Columbia and supports core climate programming that prioritizes lenses of climate justice, messy hope, community care, resilience, and unity. Meghan is also an artist and engages art to support youth and community in processing climate grief and trauma. Welcome, Meghan. Our third speaker is Nancy Rihan-Porter. Nancy joined the Cambridge Public Health Department in January 2015, and she currently holds the position of Director of Equity, Resilience, and Preparedness at the Cambridge Public Health Department, which is a new unit developed in response to the pandemic. During the pandemic, Nancy became a key player in the city's COVID-19 response and was instrumental in the community PCR testing campaign, vaccination clinics, development and implementation of an emergency shelter for unsheltered, unhoused residents, just to name a few. Additionally, she spearheaded the Cambridge Community Corps, a public health outreach and community engagement program developed in response to the pandemic that has received local media attention. Following the pandemic, Nancy began to follow trends regarding the overall impact of isolation and quarantine that has led to an epidemic of isolation and loneliness and the need for increasing social capital in our communities. Nancy currently serves as board member at large for the Massachusetts Association of Health Officers, co-chair of the Executive Committee for Region 4AB, and as the vice chair of the Massachusetts Largest Cities Health Coalition. As part of her role as vice chair, she is one of two representatives at the Coalition of Local Public Health. Nancy is also a national reviewer of 2023 NACCHO's Project Public Health Ready, recognition and re-recognition of local or county health departments that have met stringent criteria regarding public health emergency preparedness capabilities and planning. Nancy earned her MBBS of Medicine and Surgery from Cairo University in Egypt and was a general practitioner prior to moving back to the United States in 2007. Welcome, Nancy. Let's see, I'm going to stop sharing here so you can see us all. Let me organize my screens. here. And if you go to the view, if you can't see myself and the speakers highlighted, you can go to speaker view in your Zoom and you can see us a little bit better as we have this discussion. So thanks again, everyone, for joining, and thanks to our 3 wonderful speakers. I'd like to kick off some of the discussion with a little bit of introductory words. Tell us a little bit about the work you do and what inspires you to do that work day in and day out. Who would like to start?
Okay, awkward silence. So my name, just like, all right, so I'll just, for the sake of, reducing the awkwardness, my name's Nancy, as you all heard, and I kind of fell into this work accidentally. I think a lot of us do in public health. I mean, obviously I started off as a physician doing a lot of community health work, which is in Egypt, the way that we do med school there is that you do 3 years, you do 6 years total of education, and then you do internships and residency. And a part of that, for 3 years, you do take community health, which is public health, and it's embedded into the core of medicine over there. It's not separate where you would get an MD and an MPH, for example, like many folks do here. And through that work, I was exposed to a lot of the environmental kind of challenges that I'm sure that Dr. Shah will touch upon, specifically, waterborne diseases and other communicable diseases. But we started to also notice that there were other kinds of trends going on, in many parts of the world, as I'm sure many of you know. Mental health is not talked about easily. It's shunned, it's, stigmatized, it's, put them in an institution, you can't see them, so you don't have to worry about it. And that always really struck me as being even more upsetting and more isolating than whatever it is that was going on with the individual in the first place. And so when I had the opportunity to work at the health department here, and I started off in my role, I was looking obviously at the emergency preparedness work, but I realized that we were kind of stymied by the fact that, people think that, we're responding only to a massive disaster or something. It's the small insults, it's the small disasters that happen every day, I think, that wear people out. There's a poem that I can't even remember who wrote it, but the woman in it said that the reason, she died by suicide, and the reason was, it was the buttoning and unbuttoning of things, right? Thinking back on like those corsets that they used to have to wear, and the tediousness of your life. And I think that factors into it. And then you compound it with all the climate change impacts. And I don't think that people understand the significant impact that it really does have on who you are. It's the small disasters that start to chip at you. Look at the news, between the Moroccan earthquake and, all the other stuff that's been happening, and then the crisis and that's man-made over in, the Middle East, which is something that's, very personal to me and to others here, I know. It eats at you. And so the only thing that I felt that was in our ability to really, really do and have a change was to bring people together. And so for me, that's where my passion is. I don't like people, generally speaking, as a general rule, I'm not a fan, but I can handle when I'm doing the stuff up here and getting other people to join together. That's what makes me happy. So.
Great. And it's those deeper relationships that you develop that make you enjoy the people you're around. Right. Great. Thank you, Nancy. Anyone else like to talk about? Yes, go ahead.
I'm happy to. So I'm Dr. Shalini Shah. Thanks for having me here today. So wonderful to be part of this community and see fresh new faces. I'm passionate about the climate crisis and what we can do to be of help. So to speak to my experience, I first learned of climate change as this ambitious undergraduate who was on this fast track to pre-med and medical school. And as I pursued medicine, I always had this climate question in my head and really felt like it was watching this evolution of, is climate change real? Is it happening? Are we going to be able to come up with solutions even to it's here now affecting all of us? And, there are so many obstacles, but also a lot of hope along the way to kind of get us where we need to be. And I pursued pediatrics because I'm so inspired by children and have really felt like this responsibility to be able to advocate for them and to protect their health. And so as I've evolved, I've kind of seen climate and health linking everywhere and truly recognize that climate is a health issue, in addition to all of these other spheres, and that health is really a unifying factor that can bring awareness to this issue, bring people together and energize them, and hopefully allow us to move the needle forward towards climate solutions and also better prepare our communities for what we're already actively dealing with. And so my passion kind of in the medical sphere is kind of bringing that education into bedside practice. So talking about, your child's here for an asthma exacerbation. Let's talk about air quality in your community and how that impacts you. As well as screening for those things up front within our asthma center. So we screen for environmental exposures and have a systematic plan to address them, including points of climate vulnerability like exposure to extreme temperatures, or energy insecurity, food insecurity, kind of these systemic layers that build upon each other. And then we hope to kind of learn from the research of what we learn from our families to be able to advocate for them on a larger scale through legislative policy. So I kind of think of climate as a multi-pronged issue, right? And to be able to engage across the sphere of educating families, researching and advocating for policy, and then also working to educate one another in the health sphere to kind of bring these considerations into our practice so that we're providing care that's relevant and up to date and acknowledges these issues on a bigger scale.
That was wonderful. So great to hear all of the passion behind, what brought us here. Yeah, my name is Meghan Wise. I use she, her pronouns. I am located in so-called Vancouver in Canada. And my climate kind of journey or story is, resonant of things that were already said, but I grew up in an area that was very prone to climate impacts as well. So growing up, I've lived through mass wildfires, I've lived through drought, I've lived through, the heat dome, the Pacific Northwest heat dome that claimed 619 lives within 6 days. And it was scary. It was a very scary experience to go through. Recently, this past summer, my home community has gone through massive wildfire again. And so there's just been this kind of long growing awareness of things drastically changing around me. Again, that sense of place, connection, home, community, really recognizing how we root in community and that sense of place that we have, and then how that's being disrupted by the issues and impacts of climate change. And so that was percolating in my awareness. So, speaking to going through undergrad, going through academic journeys, going through a master's, going through all these experiences, constantly having that question of how does this relate to climate change? How does this relate to the driving issues of climate change? How does this relate to how people are experiencing climate change? So I did a lot of work on climate impacts on migration, human migration, gendered impacts of climate change. Also, how our ideologies are connected to our experiences and understandings of climate change, and how ideology also drives part of what the systems are that we experience in relationship to climate change. And so, again, thinking about this from a very systems kind of interconnected perspective, and really having to think about what are all of these interconnected factors that build our communities, build our experience, build our situated awareness within the world. And then being able to, again, like Dr. Shah was saying, is again, thinking about how are we then connecting this to individuals? How are we then connecting this to community? How are we connecting this to systems? And then thinking about what is the education? What is the awareness? What is the community building that needs to be done? And so that's where a lot of my focus and energy has been. I've done that in the work that I do. I do that via climate programming, working with youth, working with students, working with community, and again, policy awareness and what are we shifting? And the community that's here today has a lot of power in how we're thinking about supporting community in navigating some of these challenges. How are we thinking about that in relationship to planning, policy, people, education, and community building? So I'm really excited that this community is here today, interested in these issues and topics, and hopefully we can kind of move through some reflections on how to support and things like that as well.
Thank you, Megan. I think it's great that we're already kind of talking about these systemic barriers and planning opportunities, as we have a lot of planners on the call. So definitely want to kind of raise up some of the issues that we think about when we're doing any type of planning, from climate action planning to community resilience planning, which is often integrated in a lot of the plans that we work with municipalities. So how can we make space for climate change's effect on mental health in that climate resilience planning, in community resilience planning specifically? How can we make space for that and kind of uplift those conversations?
I mean, I think one of the things that I've found is that climate solutions are health solutions. There's co-benefits to these things. And so I try not to think about them too separately, and instead of kind of adding that lens to what you're already doing. And so if you're thinking kind of on a planning perspective, for example, about access to cooling for extreme heat, the health layer for that, or mental health layer, is really that like mental health is impacted by extreme heat in that it impairs our ability to learn. Studies have shown that, decreased cognition in teens and adolescents in schools with inadequate access to cooling. Decreased sleep can impact those who already have underlying mental health conditions and lead to exacerbation of their symptoms, and then also kind of, impacts efficiency and our relationships with one another. I mean, you can all imagine how you feel when you're overtired several days in a row and overheated. And so kind of thinking through, like, what lens are you using, or what is your sphere, and how are you kind of adding that climate lens to where you're planning, and like highlighting the health benefit for that may be a way to kind of garner more support for your cause or funding or some of these other things.
Yeah, I really appreciate that health lens to the heat. If I could jump in as well on this. Yeah, and I think it's really interesting. So I found a recent research article that was actually talking about the impacts that climate change are having on work culture. And we actually don't know, because it's not actually being studied. And to your points about the impacts of, for example, just one example of the heat, we also know there's gendered impacts of that. We know rates of domestic violence go up during heat domes and heat events. We know, right, there's different dynamics here that then all of a sudden start to impact work culture, and we actually don't know what that looks like. So again, thinking about this community here today, and how you work as a institution within community, thinking about how do you proactively integrate this into your practices, into your work culture. So instead of having it as an add-on, thinking about what are these dynamics as a work culture. So again, thinking about that from your own inside work culture, but then also thinking about other people's work culture in your community. And then I would also say, we use this word community a lot, but what does that actually mean? Every community is different. Every community is unique. Every community has its own nuances and history and culture and context. And so there's never going to be a universal application of resilience or of public health in all regards. So again, thinking about differentiated impacts of climate change, for example, on Indigenous communities, that requires a different community public health response or climate response. And so get to know your community. What are the nuances of your community? What does that mean? What does that look like? And then really leverage the existing strengths of your community. What are the opportunities that exist within your community that you can really hone in on and tweak or amp up, or kind of use as leverage points for quick capacity building to meet those resilience goals? So thinking about some of that as integrated into resilience in that planning, in that public health lens, in that intersectional lens of intersecting systems that are informing and impacting community.
Thank you so much for that. Nancy, anything to add to that?
I mean, obviously from the public health perspective, and so I appreciate Dr. Shah using the health lens. I mean, we know the way that I kind of think about these things, it's because I do a lot of emergency preparedness, and inherent in that is the idea that you need to be prepared. And what does that even mean, right? And so the concept of, social resilience and social capital. It just sounds so cold, but that's what it is, right? It's human capital. It's the riches that we have in each other, if you will. And so regardless of the event, whether it's climate, man-made, terrorism, whatever it is, the stronger we are internally, right, individually, the stronger that we are collectively. And so it's less about what is exactly the impact that's causing the stress or whatever. It's the same idea, is that if you are taking care of yourself physically, emotionally, relationship-wise, then you're going to do that much better. It's the fact is, humanity, like humans, we need interaction, whether we like it or not. Again, I don't like people, but I still have to deal with them, and I actually need them to thrive, whether I like it or not, right? Like no person is an island. And so, I mean, if you even think about the health impacts of, social isolation and loneliness, I mean, it's the equivalent of smoking 15 cigarettes a day. It's the equivalent of 50% of folks who live, who identify or state that they are lonely or are socially isolated. If you're an adult, 50% higher rates of dementia. On average, the death or, health effects that are caused by, the social isolation and loneliness, it's insane, the data that's out there. And I mean, it's available for anyone. And the fact that, the Surgeon General, Dr. Vivek Murthy, released a whole thing about loneliness, as an epidemic in public health was massive. And, and the way that we think about these things are different. In Europe, for example, in the United Kingdom, first time I ever heard of this, in the UK, they, like about 6 or 7 years ago, prior to the pandemic, they appointed the Minister of Loneliness. Because over there, it's all the offices, government offices are the ministers. In Japan, they just did the same. They did a minister of loneliness and social isolation. This is not a unique thing, right? Everybody's experiencing it. And with social capital, by having people who are more resilient before a disaster or a catastrophe, even if it's not in your view, my view is different. It could be a catastrophe for me. It's not a catastrophe for you. But the more resilient we are before that, the more likely we are to thrive. And, you can look at what happened in Fuka, what's that place in Japan? The Fuka, I'm going to say it wrong. It's going to sound like I'm saying something wrong, so I'm not going to say it. But essentially, they were studying about how Dr. Daniel Aldrich, if you have the opportunity to look at his work out of BU, he basically, what they were able to identify was that there were communities that were impacted by the earthquake and then the nuclear fallout and the tsunami and all the other nonsense that happened as a result, right? But there were two towns, little towns next to each other. One survived and came back stronger, and then the other one was deserted. And so the study is like, what was happening that was different in the community that came back even stronger and made them thrive versus the community that just dissipated, where everybody disappeared. And it was all social linkages. It was community. It was about having a say in your government, civics, right? It has a say in your child's education and everything, and having a role if you're a shopkeeper, if you're a seamstress. And so finding all of that together and weaving that all in, that's what makes a community stronger. And as a result, you're stronger individually. So, I don't want to belabor the point, but I kind of get jazzed up when people are talking about this. So.
Thank you, Nancy. That's really compelling. We definitely will be kind of dropping links to resources that our speakers mentioned in the chat, but would love to follow up with more of them because they're really compelling studies out there. I'd like to talk a little bit more about some of these systemic factors, barriers, or challenges that you see the communities you work with experience, and how those don't support mental health, and how maybe suggestions about how we can address these, or experiences you've had that have been successful in your work.
I'd like to take this, if I may, to start. I think that systemically, we know that there's a lot of problems in the mental health world in terms of provision of services, finding providers that are able to even take a patient, and then compounded by the fact that there's no really very small numbers of providers of color for mental health, right? And so, there's unique programs here, for example, where, they give out fellowships, et cetera, to students who are studying, for example, at the William J. School of Psychology or something like that, one of the colleges around here, which is basically like a $5,000 scholarship, just because you're going through it and they know how hard it is. And they provide supports to encourage people to go through and take that path, because there's such a lack of, providers of colors. And then inherently physicians, Dr. Shah, self-included, and myself, I can say quite easily, I don't think that it's only recently I feel that, people are starting to pay more attention to the kinds of impacts, that the ripple effects, if you will, of something that happens at a catastrophic level. And so I do think that we need to do more investing in healthcare. Obviously, that's not like a revelation to anybody, but we also should be able to enable and incentivize our providers to talk about this stuff, to ask those questions. How are you doing? Who are you connected with? It's, you could talk about the social determinants of health, or in the healthcare world, it's more about health-related social needs. It's the same thing. Right? It's food insecurity, it's transportation, it's access to open space, it's access to transportation and opportunities to, grow in your job or your future. And then the way that it works for us is that public health, and we have the ability to really track the community resilience, the prevalence of disconnection, and try to come in and intervene then. But instead, it would be just so much smarter if we took the upstream approach, right? Where we stop throwing the babies into the river, and then instead of trying to scoop them up after. And so I do think that if we could just integrate conversations about health, mental health, and social connection all through the levels of care, right? Primary, secondary, tertiary, prevention, care. If we can do that, that's when you start to mitigate the issues that you could have with social connection, And the thing is this, let me just say this last thing. I just want to clarify that when we say loneliness, that's a very subjective state of being, right? I feel lonely, right? And yet I could be in a room with 1,000 people, correct? Social isolation is a lot more objective. You're not connected. You don't have, spiritual supports, or you don't play a sport, or you don't have a book club, or whatever it is. And so you have to compare and contrast those two, and you have to address them differently. Right? They have to be addressed differently, but to be successful, they need to be addressed together. So that's just my 2 cents on that one.
I agree. I appreciate all of those comments. I think building on kind of that healthcare piece, I do think one of the systemic barriers is really limitations in access to healthcare and kind of the inequity built within that. And then when they do reach us, I agree with Nancy, like we are certainly realizing kind of mental health as a whole as a crisis kind of more recently. And I think the climate knowledge and intersection of that is also growing, which gives me a lot of hope. But from the provider perspective, it's really hard time-wise to fit everything in. And having kind of support for the providers, and one, making it as efficient as possible, and kind of incentivizing investing that time in those conversations will help get people more engaged when they do reach that end point of healthcare. But then I also think kind of all the work that's happening in the community and what you all are doing as the different pillars of the Metropolitan Planning Council is like having strong, sustainable, community-based resources that providers can then be aware of and refer to is so powerful to kind of help that linkage work. So many times, we develop or share kind of the cooling center list in the summertime with extreme heat of like, this is what's in your community and available to you. But a lot of those cooling centers have temporary funding or have kind of shifting hours or availability. Same with like food banks and different arms of food insecurity. And so I think, shifting to have real like long lasting pillars of aid in our communities, and then kind of sharing that with your providers. We love to have resources to share with people, but I think it's a lot of work on our end to kind of try to find those and then feel like they're shifting all the time.
And thank you so much for all of that. I'm so appreciative of the community working on these issues and weaving it together so wonderfully and beautifully. And I just want to go back to also thinking about these as root causes. what are the root causes driving mental health? So again, we can think about the system that needs to respond to mental health, but we need to go back, especially as planners and community organizers and kind of community relationship navigators, is again, thinking about what is driving these intersectional, multifaceted dynamics of mental health crises that we are facing. Climate change, COVID, again, you know, these were mentioned, housing insecurity, food insecurity, opioid crisis. We know that there are multiple factors, but again, we have to go back to some of the root causes. We also have to talk about racism, systemic racism. We also have to talk about how our types of economy are also driving mental health. So again, thinking about the degradation of environment, thinking about how access to green space is a really important dynamic of mental health, and yet green space in communities is very thin and sometimes inaccessible. So when we think about the compounding impacts of health impacts, air pollution, lack of green space, lack of cooling space, then all of a sudden we have this these intersecting nodes of really profound intersectional mental health development. And so as planners, how are we going back to integrate deep care and well-being as part of the planning process in thinking about the root causes that are driving climate change? So again, we were talking about cooling centers, super important, necessary emergency preparedness work, but at the same time, how are we making sure that the planning and policies have heat pumps in community buildings and apartments so that the mental health aspects are actually being proactively mitigated in long-term sustainable ways? How are communities integrating green spaces adequately so that, again, the mental health isn't having to be magnified, and then there's this huge strain that is then directed at the medical system that is already dealing with other compounding issues of public health and well-being as well. So again, thinking about the intersection of COVID, the strain on the system, then a climate challenge comes along. So for example, in the Pacific Northwest, middle of COVID, along came this heat dome and it almost buckled our medical system. That's why so many people died. There was no care available. There was no first responders available to address that. And so again, thinking about as planners and policymakers in these positions, what is it that we can just tweak and leverage to deepen the sustainability factor, deepen the care factor, and have co-benefits of public mental health and well-being at the same time?
Yeah, I'd like.
Oh, you muted yourself, Nancy.
Sorry about that. I'd like to add, thank you for saying that, Megan. I was thinking when you were talking about, what we've been trying to do also here in Cambridge is we're trying to implement the framework, of health in all policies, right? Where you take a look at every single policy that's coming before city council and the legislature and identifying what are the pros and the cons. Literally, the bottom line is like, what is the benefit of doing this kind of policy and what is the benefit, or what would be the downsides, right? And looking at it and approaching it from that particular framework and lens, it just lends itself to better policies, because every single thing that we do anything about impacts your health in one way or another. There's overall health impacts. If there's a shooting in the neighborhood, everybody's impacted. If there's anything that goes on, even if you have a community, I'm not going to get into the weeds on it, but we've been really trying to work so that we can get an ordinance passed eventually. I pray, I hope, I've been working on it to get an ordinance passed where every policy order that would come from city council would have two things on top. It would have a health in all policies statement, basically an impact statement almost, and as well as a financial or a cost benefit analysis in terms of what is the value here? Is there value in this beyond the monetary value? What is it going to cost us, not just financially, but in terms of social capital? And looking at it from all of those ways makes it really, really compelling to people. Because I think that people, when they stop and they actually think about it, they realize that everything that we do in government trickles down to us. And I want to say one last thing about cooling centers. Yes, Sharon, they are my pet peeve. I am not a fan because I often feel like that's just a nice little Band-Aid that doesn't do anything. We've stood up cooling shelters. I can't even tell you how many times. And we've actually had maybe the highest turnout was 2, just to show you how impactful that really was. And so it's important, I think, to look outside and be creative and think about what about getting an MOU or a memorandum of agreement with the local movie theater on those really, really hot days. And the city would cover that cost. For example, there's food, it's cooling, there's restrooms, and it's got entertainment, right? So people might be more inclined to go do that. So thinking about things that are just a little bit outside of the way that we have to think, I think that it requires a lot of creativity. And that's why I love when people bring in arts and culture and different things into this work, because it has a different kind of impact on people, right? It shows that there's so many different ways to be involved and that it's not as hopeless as one might think. You know, things can be done to make things a little bit better. So.
Thank you. I think that's really a great point to bring up, how we need creative solutions. And to Megan's point earlier, for each community is different. So solutions need to be customized for that community. And I love that we've started talking about already some of solutions that we can offer listeners for their community and themselves. So we'd love to kind of shift gears to solutions and resources. So one question we have from the audience: how do we build the systemic capacity to address these concerns? And if you'd like to offer some pathways for listeners to read and research, would love to kind of elevate those here now.
I can quickly jump in. So if I'm understanding that question correctly, it's like, what are those deeper root causes approaches that is going to start shifting more of that sustainable? Yeah, that's the big work, isn't it? One of the things, we work a lot with youth and students, and we're very mindful and conscious of really taking a systemic lens, because youth feel a huge pressure of the individual demand to address climate change, and that's overwhelming. And that's part of the mental health, I think, issue that youth face, is this kind of messaging that it's your issue to solve or respond to. And so we do really focus on that systemic lens, but what does that look like in practice? And again, that's the deeper work. So that's where we have to start really getting at what are the policies that are upholding, again, public health, a conversation we've been having here. You know, to that point too, Nancy saying, how is this integrated across all things as a starting point, not as a tack on, as a starting point? Thinking about our energy systems, thinking about energy autonomy, renewable energy autonomy, thinking about integration of healthy energy options like heat pump electrification, things like that. Public transit. We know, because again, electrified public transit reduces air pollution. We know that that has a co-benefit. It's massive. So again, also here's a big one, thinking about integrating happiness. So this idea of well-being, mental health. So we're talking about happiness. We're talking about a sense of thriving. We're talking about how we feel in our communities. What if we integrated kind of happiness as a metric? When we're talking about metrics, evaluation, and learning, what are the metrics, evaluation, and learning that we're actually using in the work that we're doing in our planning and policymaking? Is happiness a part of that? Is care a part of that? Is well-being a part of that? And if it's not, we need to make it that. And then, you know, thinking about, engaging with your representatives, claiming space and time at your city councils, like getting involved in those political narratives and conversations of what does systemic change look like as a community? Because again, this is about community good and thriving and sustainability. And so that will take some deeper engagement. One of the big things too, just talk about it. Catherine Hayhoe, wonderful climate communicator and advocate. One of the most powerful things people can do is talk about the impacts of climate change, the solutions to climate change, and the community benefit to taking action. That alone can have a big ripple effect on bringing other people into that conversation and identifying causal relationships between what we're experiencing and the impact on our health and well-being in communities as well.
And also building upon kind of thinking creatively from that question about kind of what are the systemic answers of how do we build the systemic capacity. I think many hands make lighter work. And so kind of fostering collaboration, partnerships in these spaces between kind of governmental bodies, community-based organizations, bringing in healthcare sphere, you know, private sector, kind of how can we share resources resources and knowledge with one another to kind of move the needle is really imperative. And kind of thinking about like that spectrum that's been mentioned today, like primary prevention, starting, up front, how can we think about these things so we're not kind of dealing with the downstream effects kind of across that arc, and then having resources in place on the other side of that are strong and longitudinal, knowing that especially in mental health, the impacts can be often quite long lasting. And so, among children who are exposed to extreme weather events, more than a third will receive a new mental health diagnosis, and more than 10% will have persistence of those symptoms a year post-event. So thinking kind of about that longitudinal spectrum, and then hoping that over time, you're kind of feeding into making that less and less.
Great, thank you. Another question from the chat is, what is the positive role that arts can play in relation to climate and mental health?
I love that. Can you repeat the question though? I want to make sure I got it right.
Yes, it's what is the positive role that arts can play in relation to climate and mental health?
So I love this. So in Cambridge, through one of the grants, actually through MAPC, my buddies, we have in the city of Cambridge, we have this wonderful young woman who also used to work at MAPC, and she's the arts and cultural person for the community development department. And, they just were working on a project called Shade is Social Justice, which is essentially, we solicited artists to give us ideas about what kind of an installation that they would like to put in several parks around the city. And this is meant to offer shade, obviously, but also an opportunity for placemaking and gathering. And so, currently we've got 3 that are going to be going up, and then another 3 or 4 will go up in the following year, and they're temporary installations. And within that context, it's a way to just try to bring people. And I think it's really important also that, we hear a lot of people talking about placemaking and all of that stuff, but I think it's really important to think about how inclusive those things are. For example, if I am, say I'm an Egyptian woman, as I am, who is veiled, for example, I'm not going to be comfortable going to a park, for example, where maybe I won't be comfortable going to a park where there's a giant nude structure, right? But if there was a place I went to, for example, and maybe they did some Islamic art, and they use some of the cultural parts of the components of our countries, our different backgrounds and our really rich histories, then it completely changes the dynamic. Is that it becomes it's not just accessible, it's more that you want to go, right? Like I think of certain areas of Cambridge where the very significant South Asian population. And the reality is that, they have different ways of wanting to do things. And so they're not using maybe the green spaces because the green spaces are ugly and it doesn't represent them and it doesn't feel like they belong there. So we let them, the idea is you can go in there and make your own changes, as well as addressing climate change and engaging with people and stimulating conversations. I mean, these are the kinds of things that I think, they do this in other places in the world. In Europe, they have the benches which are identified as being, if you sit down on this particular bench, that means you want to have a conversation, right? And we learned the power of that during the pandemic when we launched the Cambridge Community Corps. The whole premise was really they wanted us to be like the masking police, and we weren't going to do that. We're public health. We don't enforce that kind of stuff. And so instead, we totally flipped it on its head. Yes, to Claudia. Yes. And so we kind of flipped it on its head. And one of the coolest stories I heard, because most of the people that were taking this job, there was a lot of college kids, and stuff everybody was in quarantine and bored to death. Everything was shut down. And one of the best things I heard from that program, to me, that was a metric of success, an indicator or a measure of success, was this young man who worked for us, built a relationship with this older man that they would always run into each other because the younger guy from the Corps was always going through that particular area. And this gentleman would sit on the bench and read. And one day he couldn't, once the pandemic ended, their friendship continued in a non-creepy way. So, I mean, that's awesome. He couldn't go to a concert, and so he gave it to the kid. Like, that is community. They don't even know each other, I don't think they could even tell each other their last name. But when you have those kinds of opportunities and you create those opportunities, all you have to do is sit back and watch. And then the magic happens all by itself, right? You know, I'm a huge fan of block parties. We just did an initiative in Cambridge where we gave out $200 to any who wanted to have a block party. No questions asked. And we removed barriers to access so that there was no permit. There's no fee per permit. The number of abutters that you had to get signatures for was decreased from 75% to 25%. Like things like this, right? And we just give them the money, and we managed to triple the number of block parties held from 2022 to 2023. That's significant. That is a significant jump, and it shows that people are just hungry for this, hungry for that kind of connection, especially in communities like Cambridge, where you have a high population of renters. You have a lot of people from the financial, the pharma industry, as well as higher education. So it's quite transient, you know, and so any opportunity for you to get to know your neighbor, it sounds so cheesy, but it's the truth. That's why we all love Mr. Rogers. Like, just meet your neighbor, you know, and that'll take care of it. There's not some massive solution that needs to be offered. Have a party. That's all you got to do. And we don't have to sit there and pontificate about the value of it from a pulpit, right? We don't need to beat you over the head with it, because we know that the outcomes, we understand as professionals in public health and medicine and all of this stuff, we understand the positive health outcomes that come from having a block party. Nobody else has to worry about it. Just have the party and let's see what goes on. So I think that there's things that we can do tangibly, you know, just carry somebody's flipping groceries for them. You see that lady down the hall, you know, or down the street, she's struggling, carry them, you know, I mean, reach out, extend yourself. It's even for people who are ornery like myself. I mean, when I do that, I still feel better about myself, right? It takes me outside of myself. And that's also really important. And there's value in extending that to people.
Thank you, Nancy. Go ahead,
And
Megan.
if I could just quickly jump in, I know we're close to time, but I want to really just bring this back to art, because the importance of it is so, I think, profound. One of the things I see a lot from a lot of youth and community that I work with is the use of art to just imagine the future. Again, youth are really confronted with this very intense reality of a very complicated future. They hear a lot of doomism. They hear a lot of kind of nihilistic narratives. And art and imagination and creativity can be a way of imagining the future in really beautiful, bold ways of what is possible, what is even possible. The systems that are exist, but they were created. What else could we create? And so creating the opportunities for not just youth and students, but community to be able to dream up together what is possible is a really interesting and powerful thing to offer. The other thing that I think is really important about art in relationship to working with youth and students and community in general, for that matter, is it helps when we don't have the language we need to talk about climate change. We might not quite fully understand, why do I feel like this? But then we can put that into art, and art helps us make sense of things that we don't have language for otherwise. And so it is a way of being able to process complex emotions, weave together things that seem disconnected or separate, but in a way that kind of makes sense. And art is a really interesting medium that offers that. The other thing that's really important, again, for policy planners, makers, bring artists into that process. We actually know that art and visual graphics and imagery and things like that help to communicate complex information a lot more clearly, and it resonates with people more. So if we're trying to communicate language and issues of climate change, how are we doing that? Are we doing that creatively in a way that makes sense for community and that calls people in, as opposed to shuts people down because it might be this doomist narratives or something like that? So thinking about our framing, thinking about art as a medium for really important community engagement.
I think that was so beautifully said and really speaks to kind of the power of art to be kind of its own communication tool and education within the community, and like starting those conversations. I feel like I find the most hope in community and finding others that are passionate about this and working towards this, and also from my patients as a community. And so feeling like they are seen and can kind of bring this voice to something that is hard to explain how you're feeling is so important. And I also think just kind of the role of validation. There's so much eco-anxiety, kind of this sense of doom that's really impacting the mental health of youth and adolescents particularly. And I think, validating that that's a very real, natural, appropriate response to what is happening, but modeling coping mechanisms to deal with that in a way that is seen kind of in all aspects of, the parts of society is really, really powerful and really important for children, especially.
Thank you so much. I was going to do a last fire question of kind of what a hopeful lens we can offer for the future, but I think ending on the importance of art and expressing yourself and cultural considerations is a great one to end on. So thank you so much. And thank you again to all of our listeners for joining us today. We will have another webinar for the speaker series on December 13th about clean tech in your community. So look out for that through the various communication channels that you learned about this webinar through, and we will see you there. So thank you again to Dr. Shah, Nancy, and Megan so much. We learned so much from you and had a really wonderful conversation. So we hope you all can take this inspiration through the rest of your day and enjoy the last few days before some holiday breaks coming up. So thank you again, everyone, and have a great day.
Thanks for the opportunity. Really appreciate it, everyone.
Yeah, thank you all for your time. Please reach out if anything seems like we can help amplify your work. We're always happy to engage.
Likewise, lots of resources to share if folks are looking for any climate, mental health, and wellbeing resources.
Absolutely. Sounds good. Take care, everyone.
Take care.
Bye.